So today we're going to be talking about shockwave therapy. The full name for this here is Extracorporeal Shockwave Therapy. And this is a non-invasive treatment that we have that uses sound waves to promote the body's natural healing response and reduce pain for a lot of musculoskeletal conditions. Our shockwave works in a couple different ways, but the two main ways that it works is it uses percussion therapy to break up any scar tissue or injury to the muscles, tendons, or ligaments that we're treating to promote a healing response for them. And number two, it also uses sound waves, which recruits blood flow, brings blood flow to the area. It recruits growth factors and healthy inflammation for the injured tissue to get it to heal. There's a lot of different conditions that we've treated shockwave with, but in general, it's for muscles, tendons, soft tissue. But we've actually used this a handful of times to promote bony healing for stress fractures or fractures that just aren't healing on their own. A lot of the common conditions that we treat this shockwave with are plantar fasciitis, elbow tendonitis, shoulder or rotator cuff injuries, and then it's been really good for muscle tears or strains like the calf or hamstring tear. We also use it for muscle trigger points and even stress fractures like we talked about. So that's why we like shockwave, is because it's a very natural treatment. There's really no side effects to it. It's really just us augmenting the healing response for your body. So here's what our shockwave machine looks like. We have it set to the Achilles setting right now. Here's the gun of the shockwave, which is what we're going to be doing our treatment here. People can have a little bit of discomfort with it at times, but the good thing is I can turn up or down the intensity for patient comfort. So we're going to give you an example today for the Achilles, just to see what shockwave looks like a little bit here. So we use some ultrasound gel. All right, and then you'll hear just a little bit of that percussion therapy as it's sending its sound waves. So in general, treatment is going to last anywhere from 3 to 5 minutes, depending on the duration and the intensity. In general, we usually do about 2 or 3 treatments about a week apart, so that way we really get that cumulative benefit. And after that second or third treatment, then we kind of reassess what sort of response you're having. Are you responding positively to it? On average, for the conditions, we usually do about 5 to 6 treatments total, but we kind of see how it's doing for the patient, what degree of relief they've had, and talk about next steps.